Namaste, welcome back to our channel Ayurveda 360. Each and every person on this earth will be visiting one or the other physician due to some illness. During this time, a particular medicine or medications are prescribed. Also, there will be some food and regimen related advice. It could be restrictions. Usually, the patients are not having that much of patience to listen and follow to each and every instruction. They're always in a hurry to stop the medications and go back to their routine life. Now, is it right, or what are the factors we need to consider to say that my body is actually come back to normalcy? Like how I was before, I am exactly like that now. So in this video, we are going to discuss one such concept, a phenomenal concept of Ayurveda, which describes regarding the perfect health status of a person in general or after a particular disease status. Irrespective of the science, medicine, what you follow, these are common for all. So kindly watch this video till the end and share it with the maximum number of people possible. So the topic what we are going to discuss in a single word can be taken as Dhatusamya. So in Ayurveda, a physician usually thinks from a patient's perspective in relation to Dhatusamya, not just subsiding the disease, but to bring back his Dhatu towards the normalcy. Now, what is this Dhatu? What is this Samya and all those things? We are not going in detail in this video. It is more targeted towards the common public. So we are going to discuss certain of those symptoms, what the physician usually observes in a patient and tells him that yes, now you are absolutely fine, you can go back to the previous diet and regimen. So you don't have to worry about the restrictions, whatever I mentioned, you are absolutely normal. So what are those symptoms? There are 12 important symptoms. We'll go one by one. The first one is called as Rug Upashamanam. Rug Upashamanam. So now what is this Rug Upashamanam? Rug is nothing but the pain or discomfort. In this context, it is the discomfort. Sometimes you might have got a simple disease like raised body temperature, which your physician might have diagnosed it as Jwara. And they might have prescribed you certain medicines which might have increased or decreased your raised temperature. So once the temperature has come back to normalcy, this is called as Rug Upashamanam. In this context, raised temperature is the issue, Rug, discomfort, and that has come down. Another day, you might have gone to a physician with the complaint of vomiting. You went to the physician and he has prescribed the medicine, vomiting stopped. That is Rug Upashamanam in that context. Another day, you went with your grandmother or grandfather with the complaint of pain in their particular joint. And for certain time, the pain in the knee joint or the ankle joint reduced. So this is Rug Upashamanam. Reduction of the symptom what the patient usually complains. It could be the burning sensation, it could be the itching in any part of the body, any of the symptoms. It is Rug Upashamanam. And this is the point where usually people take it wrong. Like if Rug is reduced, if the discomfort is reduced in any form, they usually think that they are absolutely fine. They are not worried about the next 12 points what we are going to discuss. Rug Upashamanam is only the one symptom or one feature of Dhatusamya. Now what could be the other 11? So we are discussing this one by one. Swara Varna Yoga. This is the second of the Lakshana. Swara Yoga and Varna Yoga. You might have observed people describing your change in voice whenever there is certain disease. It could be to the mildest form, or it could be to the moderate form, or it could be the higher level. But definitely whenever you suffer from any kind of disease, there will be slight change in the voice. Also, the complexion of the person, rather than to tell like change in color, the person looks dull. This is again observation. The neighbors or your relatives or your own mother or father, friends teachers, some of them who observe you tell that you are looking dull. Why are you looking dull? So that is nothing but they are analyzing your Varna. So Varna Yoga, Swara Yoga. Until and unless you get back your own, that charismatic voice, what usually the person has. Of course, it is individual based. None of the voices can be compared with each other. Each one is unique. So until you get back your unique voice completely, and also once the people around you feel that you are exactly like before, from the, you can say, Rupa. Like when they look at you, they feel like, yes, you have got back that charm, what you had earlier. Varna Yoga, Swara Varna Yoga. So this is another of the important symptom of Dhatusamya. So if the fever subsides in 2 days because of an antipyretic, and if you still have that dullness in your face and your voice is still not at like before, it means you have not yet attained the Dhatusamya. This is the point of whole discussion in this video. Rugupashamanam, Swaravarna Yoga. Next, the third of the symptom, that is Shariropachaya, and the fourth one is called as Bala Vriddhi. So once you get any disease or any change in your status of the dosha Dhatumala, in terms of Vikriti or pathological change, then usually the body will lose certain amount of weight. And also the strength of the person, it could be the physical strength, it could be the mental strength, or it could be the strength like which you can assist through his speech. All these things, in any way we are able to assist the strength of the person. So these two are another of the important factors. Your body should get back that lost kind of like dhatu. Sharira upachaya, here refers to whenever you get a disease, you will lose or you will feel that weakness because of loss of certain part of the body. In the sense, slightly you will feel weak. Maybe you may lose 100, 200, 300 gram of your body weight because of lack of eating, of course, and maybe because of the pathological process. But once you are fine, you start eating well and you feel good, and then your body comes back to like prayer. Shariropachaya, your body gets back that nourishment. At the same time, your body strength, the mental strength, the ability of the person to do any kind of physical work as used to do earlier, all those things will come back to normalcy. Shariropachaya is the third one, and Bala Vriddhi is the fourth one. So next symptom, what is discussing, or the lakshana what our ancient scholars have mentioned, is in relation to the food. 3 factors are considered. One is Abhyavahara Abhilasha. Abhyavahara Abhilasha, in the sense, the person wants to have food. Whenever you have any kinds of disease, the first and foremost symptom usually seen is the person doesn't want to eat anything. But once he starts getting back his Dhatusamya, prime symptom what or lakshana what you can see is the person will feel like eating something. He wants to eat. Not only he wants to eat, at the same time when he is eating, he is enjoying the food. Ruchihi ahara kali. He is enjoying that food. He is able to perceive all the taste of that food. And he is taking that food with full of his mental concentration. Like psychologically also he is satisfied. So ruchihi ahara kali. And it is not restricted to that. After eating that food what he liked, that should also get digested. So digestive power of that person should come back to normalcy. A very important feature. So once you have food at 1 o'clock in the afternoon after getting the hunger, at 4 or 4:30 or 5 o'clock, you digested the entire meal. And again you start feeling hunger. So that is nothing but Samyak Jaranam. Kale Samyak Jaranam. When it is the time to get digested, it is digested, and at the same time the person will feel the hunger as usual. So 3 things in relation to the food. You should start to feel like eating, and when you eat, you should enjoy that psychologically as well as physically. And then once you take that food, it should be properly digested. So these 3, if they're happening, it means your Dhatusamya is coming back to normalcy. So next symptom or feature, that is in relation to Nidra. Sleep is another of the important pillar of our body, sub pillar you can say. In Ayurveda, Vata, Pitta, Kapha, these are called as dosha and these are called as pillars of our body. Similarly, food as well as the Nidra, that is the sleep, these are part of sub pillars. As good as pillars, they are sub pillars of the body. Food he has mentioned now in relation to the Jatragni. Now, about sleep. So first thing is Nidra Labho Yata Kalam. So Yata Kalam Nidra Labha. So according to his Prakriti, according to the Kala and as per his Satmata, the amount of time what he used to sleep. If he used to sleep at 9 p.m. prior, if he should get sleep at 9 p.m. and the quality of sleep should be very good. That is Nidra Yata Labha. So Yata Kalam Nidra Labha. Sleep is important. Next one is when he is sleeping, if he is getting dreams, then it means it's a disturbed sleep. Usually you might have seen people wishing like good night sweet dreams. So basically from a medical point of view, dreams are a feature of or the features of disturbed sleep. Medically it is wrong. So Aprashasthanam, that is Swapnanam. So those dreams should not come. In general, dreams should not come. And especially in this context, you should not get any kind of bad dreams. So any kind of dreams, in general you can take, that is disturbed sleep. Next, not only having a good sleep without any kind of dreams, but at the same time you should be able to wake up the next morning with freshness. Sukhena Pratibodhana. So when she is sleeping at 9 o'clock, usually when you are not feeling at the best of your health, you may sleep even up to morning 8, 9, 10, 11. Your body needs that rest. But here, once your body is getting back to that Dhatusamya, that is getting back that normalcy, absolute normalcy, you should be able to wake up at that particular point of time. Maybe 6 o'clock, maybe 5:30, maybe 5 o'clock. Brahmi Murtha, in to be specific, like earlier. And when you're awakened, you should feel that freshness. You should not feel sleepy again because you had a good sleep from 9 to 5 without any kind of dreams, and you woke up and you feel fresh. You're like you had the best of your sleeps. That means you have got back your Dhatusamya. So that is in relation to sleep. Three features have been mentioned here in relation to sleep. In another of the book, it is mentioned as Sukhena Prabodhanam. So instead of Pratibodhanam, instead of awakening part, he has mentioned other way, that is whatever we listen from others, we grasp it very fast. Prabodhanam. We get the knowledge of that in a quick manner, which means we are like alert. So that can also be the meaning. Instead of proper awakening, feeling of freshness in the morning, this also can be taken. Both are right. Both are necessary for assessing the Dhatusamya. So what is the 11th point? Along with Sukhena Pratibodhanam, he also says Vata Mutra Purisha and Retasam Muktihi. There are certain of the Vega which should be continued in the body, like Vega Dharana should not be done. It should not be suppressed, it should be passed as and when it comes, like Vata, Apana Vata, like flatus like condition, Mutra, Purisha, like maturation reflex, the defecation reflex, urine, feces should be passed whenever you get that urge. And even Shukradhat, whenever the person is indulging in sexual intercourse. So Sukhena, so the person should pass these kinds of Vega with comfort. It should not create discomfort to the patient. He should not go for the maturation or urine and feel like he is having the pain or burning sensation. No. He is passing urine, yes, right, but without any kind of discomfort, no pain, no burning sensation, nothing of that sort. That is the actual Dhatusamya. He is passing stools without pain. He is passing stools with absolutely normal consistency. In that way also it can be discussed, or you can say it can be judged like the person has got back his Dhatusamya. And the last one, that is Sarvakaraihi Buddhi Mana Mano Buddhi Indriya cha indriyam cha avyapati. Here avyapati refers to like not having any kind of adverse effect. On what? Sarvakare, from all angles. Mana, buddhi, indriya, your mind. Manas is having multiple functions. In Ayurveda, Manas is given a separate entity as like importance, and it is discussed in depth. That is why Ayurveda physicians are having good command over the psyche of the patient, because they are well versed in maintaining, or you can say handling, the psychological condition of the patient. So something like Manas having the normal function about thinking, about taking decisions and all these things, that is, Manas should be normal, should come back to normalcy. Buddhi is that like entity of the body which discusses or differentiates between the good and bad, and ultimately helps you to decide the decide any kind of like query. So your buddhi, differentiation power, and ultimately getting the decision done, that is the part of your or function of the buddhi. That should also be normal, like that should have been restored. And the last one, mana, buddhi and indriya, that is in relation to your panchagnanendriya and karmendriya. You have multiple sense organs and motor organs, like the vision, the ability to listen, all those things, the ability to speak, the ability to perceive the taste, the touch, all those things. All of your sense and motor organs should be normal. They should be able to function normally. Then it means you are in the pink of your health, like you are in the perfect health. So ultimately, if these features are present in the body, then only you can say that your body is absolutely like earlier. So once you have certain symptom like raised temperature, you go to the physician, they check with the thermometer, and they say that there is an increase of 2 to 3 degree in your body, and they give you certain antibiotic. They may give you their own medicine. It could be the homeopathy, it could be the Ayurveda medicine, it could be any of their medicine what they are practicing. And next day you might have you might have got that temperature reduced. Now the second day is not the day when you are completely away from the disease. You have only developed Rukupashamanam, as I mentioned earlier. Have you got the other 11 symptoms? Are you able to sleep properly? Are you able to take the food properly? Is it digested properly? Is the voice back? Is the complexion or the charm back? Is your body strength is back? Is the body nourishment is back? How is the pattern of the sleep? What about the functioning of your sense organs, the psyche, all those things? These entities will decide that you have got the Dhatusamya. So whenever you visit a physician, make sure that you develop all these kinds of symptoms, or you can say the features. Only then be sure that you may not require medication, or you may not require certain diet. Certain times the physician may tell you to avoid food, like maybe rice, maybe it could be the curd, it could be the buttermilk, any of such food. It may be the most liked food by you, but still, until you get these symptoms, like the features in your body, kindly avoid that. That is how you decide how long should you maintain the medicine or the diet or restrictions given or imposed by your physician. So this way we have completed a very important concept, the need of the hour of today. If you analyze the features, one or the other feature may be missing in each and every one of us. Ultimately telling that each and every one of us are having one or the other issue with our health. So keep an eye on all these things and make sure that you are in the best of your health, so that all of your activities will be productive from your body and psychological strength.